Okay, think about this for a second. Of all the challenges a brand new human faces, what do you think is the single hardest, most critical job they have to do the moment they enter the world? It's taking that very first breath. I mean, it's a monumental task, right? You're transitioning from the fluid world of the womb to a world of air. For most babies, it just happens, boom. But for some, it's a real struggle that defines their first hours of life. And that's exactly what we're going to talk about today. We are going to dive deep into that struggle and demystify a condition called Neonatal Respiratory Distress Syndrome, or just RDS for short. We'll get into what it is, why it happens, and honestly, the pretty incredible ways we can treat it now. All right, so here's the plan. We'll start with that all-important first breath. Then we'll meet the unsung hero of the lungs, a little something called surfactant. We're going to see what happens when it's missing, this sort of domino effect. Then we'll look at how doctors read the signs, and finally walk through the path to recovery. Okay, so to really get what goes wrong in RDS, we have to meet the main character in this story, the key player that makes breathing possible in the first place. It's this substance called surfactant, and trust me, it is the lung's unsung hero. So what exactly is it? Well, surfactant is this special mix of fats and proteins made by cells deep inside the lungs. The easiest way to think about it is like a super thin, slippery coating, almost like Teflon, that lines all the tiny little air sacs in there. Its whole job is just to make things slick. Now here is the absolute crucial part. The baby's body starts making this stuff around 24 weeks into the pregnancy, but, and this is a big but, it doesn't really produce enough for easy breathing until way later, around 34 to 36 weeks. And that timeline, that is the whole key to understanding who's most at risk here. You see, surfactant has three really critical jobs. First, it lowers what's called surface tension. This basically prevents all those tiny, delicate air sacs from sticking together and collapsing every single time the baby breathes out. That's what makes breathing easy, almost effortless. But without it, oh man, trying to take a breath is like trying to blow up a brand new, sticky, kind of wet balloon. And you have to do it over and over and over again. It's exhausting. So what happens when our unsung hero, surfactant, just isn't there in large enough quantities? Well, it sets off this really dangerous chain reaction. Let's take a look at this domino effect of RDS. It all kicks off with one single problem: not enough surfactant. That's it. That's the first domino to fall. And once that first domino falls, the whole cascade begins. Without surfactant, that surface tension we talked about just skyrockets. The tiny air sacs, the alveoli, they start to collapse on themselves. This makes the lungs really stiff and hard to inflate, so every single breath becomes a huge effort. Pretty soon, gas exchange just fails. Oxygen can't get in, carbon dioxide can't get out. This leads to low oxygen levels, acid building up in the blood, and ultimately, respiratory failure. It's this rapid, step-by-step collapse of the whole system. And this, right here, is why being born premature is the single biggest risk factor. A baby born before that 34-week mark just hasn't had enough time to make enough surfactant. It's that simple. And that accounts for, the vast majority of cases. Yeah, there are other factors, like maternal diabetes or having a C-section that can play a role, but prematurity is really the main story here. Okay, so this whole internal domino effect, it very quickly creates signs of distress that you can actually see on the outside. So how do doctors and nurses read those signs to figure out what's really happening on the inside? Well, one of the very first, most obvious signs is super fast breathing. It's called tachypnea. The newborn is just working so hard to get enough oxygen that their breathing rate climbs way up, over 60 breaths a minute, which is the absolute upper limit of what's considered normal. Clinicians often use this handy mnemonic, grunt, to remember all the classic signs. The G for grunting is actually fascinating. That little noise you hear, that's the baby trying to create its own back pressure to keep the airways from collapsing. It's literally a form of self-rescue. You'll also see things like retractions, where their chest pulls in with each breath, nasal flaring as they try to suck in more air, and of course that fast breathing, the tachypnea that we just talked about. Now, to really confirm the diagnosis, a chest X-ray is absolutely key. And the classic thing they look for is something called a ground glass appearance. It sounds weird, but it just means that because all those tiny air sacs have collapsed, the lungs look all hazy and white on the X-ray film, instead of clear and black like they should. It is a total telltale sign that the lungs just aren't filling up with air properly. And then, a simple blood test gives you the chemical proof. It shows exactly what's going on inside the baby's body. Oxygen levels are way down. Carbon dioxide levels are dangerously high because they just can't breathe it out. And the blood itself starts to become acidic. These numbers are the direct chemical consequence of that intense struggle to breathe. Now, for a condition that sounds this severe, here is the really good news. Medical treatments are incredibly effective. So let's walk that path to recovery and see how modern medicine tackles RDS head-on. The strategy for treatment is actually very logical. It's got 4 clear goals. Goal 1, get those oxygen levels back to normal. Goal 2, physically stop the air sacs from collapsing. Goal 3, and this one is the real game changer, give the baby the exact thing they're missing. And finally, goal 4, prevent any other complications from popping up. Support is usually stepped up as needed. So for milder cases, maybe just a little extra oxygen is enough. But the most common first-line treatment is something called CPAP. That stands for Continuous Positive Airway Pressure. It's a machine that just gently pushes air into the lungs to physically keep those little alveoli propped open. Then, for the most severe cases, a mechanical ventilator might be needed to completely take over the work of breathing for a while. But the true miracle here, the absolute game changer in treating RDS, is replacement surfactant therapy. Doctors can actually give a liquid form of that missing substance directly into the baby's lungs through a breathing tube. This isn't just treating the symptoms, it's fixing the root cause. And the improvement can be incredibly dramatic, sometimes in just a matter of hours. Okay, one last important point here. It's really crucial not to mix up RDS with a similar sounding condition called TTN. Their causes are totally different. Remember, RDS is from a lack of surfactant in preterm babies, and it can be pretty severe. TTN, on the other hand, is basically just some leftover lung fluid in full-term babies. It's much, much milder and usually clears up in a day or two. So yeah, getting that diagnosis right is absolutely critical. And that really brings us to the end of our explainer. It's pretty remarkable when you think about it, right? You can trace this whole huge problem, all the way up to respiratory failure, back to a single missing substance. Just understanding this one little molecule, surfactant, has completely revolutionized how we treat this, giving us the power to save the most fragile of lives and help them take that all-important very first breath.